Okay, a question I get asked all the time, listen, it's understandable for the men and women that are out there that are looking for a solution for themselves or for their spouses or their lovers. You want to see before and after pictures. Unfortunately, that is not how that works, at least not for me. It's something that's very sensitive, and it's just not an area that I'm comfortable sending out before and afters. If you'd like to see that, you can certainly go online and find cartoons that are available, particularly on YouTube. But what I wanted to do was I wanted to take this moment to show you the procedure using a model, because this is what I do when a new client comes in, is I talk them through what we're going to be doing. I teach them the anatomy, what we're working on. So I just want to take a brief moment to talk to you about that. So there are 3 parts in the area that we're treating. I'm going to use some technical terms for the moment, but we talk about this in the exam. So the top part of the penis here, that's called the hilus. This is an important area because this is where the nerves and the blood vessels come in that ultimately end up feeding into the penis. Then you've got the shaft of the penis. This is where all the blood vessels are. This is where scar tissue can accumulate. And then last but not least, we've got this area down through here called the 𝗪𝗃. And you can see the red is all muscles. Okay, and so what I want to talk about is, yes, we do treatment to the penis and the surrounding area, but we also focus on the musculature. This musculature is called the pelvic floor, and women understand this a lot, but men don't. And so part of what I want to show you is, other than the procedure itself, we put on some gel, ultrasound gel, whatnot, and I'm just going to put the model down for a second. But the other part of this video is to talk to you about the exercises, breathing techniques, stretching exercises, strengthening exercises, Kegel exercises. These are words that you may know. If you don't, I am sure if you've gotten to this video, you've probably looked up treatments for ED. I cannot reiterate it enough. It is a great part of allowing you to have a better quality erection, but it's not the only treatment. There are more current treatments that you can also do. Most of you have either tried Cialis or Viagra or some other derivative of a medicine. Some of you might have even tried PRP. Shockwave therapy is one of the best ways to help with what's called angiogenesis and neurogenesis, which is the creation of blood flow and nervous tissue, nerves. So anyway, sorry for the long message. It is an important message, but I'm sorry it took so long. I hope that helps.